In the time it will take you to view this message, mosquitoes will bite 3 people who will all die. It doesn't have to happen. For thousands of years, malaria was a mysterious killer. A sudden fever, followed by chills, flu-like symptoms, and eventual death in days or weeks. Finally, in the 20th century, mankind learned that malaria was transmitted by a parasite that multiplies in the gut of mosquitoes. We learned how to diagnose and treat malaria, how to reduce the mosquito population, and how to monitor human populations for signs of reoccurrence. By 1951, malaria was eliminated from the United States. Soon afterwards, the World Health Organization began a moderately successful effort to eradicate malaria worldwide. But Sub-Saharan Africa was deliberately left behind. Why? Wars and massive population movements, intermittent funding from donor countries and non-governmental organizations, lack of community participation, and lack of will. The consensus was that malaria could never be eliminated in Africa. The result? More than 900,000 Africans died every year for almost 40 years. African economies lose more than $320 billion a year as a consequence of illness and premature death caused by malaria. 40% of public health spending in African countries affected by malaria is used to treat the disease. 40% of all drug expenditures in these countries is used to buy anti-malarial drugs. But times have changed since the 1950s. Many African countries are more stable. Non-governmental organizations have more financial resources. Diagnosis and treatment of malaria has advanced. Yet, we are still learning. We've learned that some adults carry the malaria parasite without any symptoms. Others carry the parasite, which occasionally causes them to suffer from flu-like symptoms. Both groups become part of the disease cycle when mosquitoes bite them, becoming infected and spread the disease to malaria-free people. Most important, we've recognized that mankind is globally interconnected through travel and culture. So the world renewed its anti-malarial efforts, focusing on reducing its deadly impact rather than eliminating the disease. By 2012, international organizations spent 25 times more on malaria reduction compared to the year 2000. Today, more than 3 million people are still alive in Sub-Saharan Africa alone, thanks to rapid diagnostic tests, more effective treatment, and mosquito nets. These efforts have reduced malaria in some countries by more than 50%, yet gains in malaria reduction are fragile. Every minute people still die, adults still get sick, national economies still suffer, all from a simple mosquito bite. Now is the time to eliminate malaria in Africa, using well-established protocols from America and other places around the world. The elimination of malaria is possible, but how? The Akosombo Malaria-Free project will show the way. By concentrating established World Health Organization recognized procedures over time in Akosombo, Ghana, the site of Africa's first and most famous hydroelectric dam, a contained geographic area of 30,000 people. We believe malaria can be eliminated there in 5 years. 1. Diagnosis and treatment. The project will use saliva-based rapid diagnostic test kits, developed by one of America's leading medical schools to test Akosombo's entire population for malaria. With their consent, residents with malaria can be quickly identified and treated. 2. Education. Local healthcare professionals will teach the population how malaria is diagnosed, spread, treated, prevented, and eliminated. 3. Vector control, including aerial spraying, habitat reduction, bed nets, and the sterile insect technique. 4. Continual monitoring and surveillance of the health of the population to prevent reinfections. 5. Logistics, getting people and supplies to the right places at the right times. Will you join our efforts? For just $5 per month, less than 17 cents a day, you can help underwrite the project cost for one person in Akosombo. Success in Akosombo will prove that elimination of malaria is possible in Africa. We can then expand our work and repeat the procedures around Africa and in developing nations worldwide. Be part of this groundbreaking common sense effort. Donate today. Share this message. And remember, in the time it's taken you to watch this video, mosquitoes bit 3 people who will all die. It didn't have to happen. Help us stop this heartbreak today.